The majority of snoring comes from the throat. Is there a one-size-fits-all policy to cure snoring? They may need something called a drug-induced sleep endoscopy. Do you snore? Has someone complained that you snore? Is it causing you domestic disharmony? Snoring is such a common problem, as I'm sure you're all aware, but it's important to ascertain exactly where the snoring is coming from. Now, there may be lots and lots of reasons for why one snores. Is there an anatomical reason for why you might snore? For example, is there a problem on the inside of your nose? Is there a deviated nasal septum? Have you got nasal polyps or sinusitis? Do you have large tonsils? So when we examine your throat, have you got an anatomical reason for why you might also snore? The majority of snoring, in the classical sense, comes from the throat. So that could be due to large tonsils. It could be due to the palate being rather floppy. The majority of cases, certainly that I see, the reason why patients snore is as we lie down, our musculature becomes a bit more relaxed, the tongue flops back, and that can affect your breathing. And as a result, you can snore. And actually, snoring itself may just be one symptom of an underlying more serious health condition, obstructive sleep apnea. Is there a one-size-fits-all policy to cure snoring? The reality is no, there isn't. Patients need to undergo a rigorous assessment, and that will form a history to understand the type of snoring and whether patients are stopping breathing overnight. They may need something called a drug-induced sleep endoscopy. This is a procedure where patients are put to sleep or given sedation to try and simulate the type of sleep that they have at home. Put a camera down and see which areas of the back of the throat and nose are collapsing. Obstructive sleep apnea, slightly different from snoring. It is a serious health condition and it can be graded mild, moderate or severe. And that then in turn, if left untreated, can have adverse impact on patients' heart, their lungs, their ability to concentrate. They may complain of brain fog and ultimately, more seriously, higher risks of strokes and heart attacks.